Hello, everyone. We are back for another episode of Style and Conversation. This is another episode as a part of our 30, Flirty, and Thriving series. Today, we have Dr. Karla Booker here to talk about health after 30. I'm so excited for this conversation. This is such an important topic for ladies as you're entering 30, as you're in 30, just to set us up for health and wellness for a long vibrant, abundant life. Dr. Karla, I'm so excited to have you here. I am going to jump right in and go over your bio. Dr. Karla Booker was born in Washington, D.C., while her father was completing medical school at Howard University. She dreamt of becoming a physician since she was the age of 11. She was raised in the San Francisco Bay Area and is the third generation of her family to attend Hampton University, where she was a communications disorder and pre-med major. She's a graduate of Meharry Medical College in Nashville, Tennessee, which is the second historically Black medical school in the United States. She completed a residency in OB and gynecology at Georgia Baptist Medical Center here in Atlanta. And she completed her chief residency here at St. Michael's Medical Center in Newark, New Jersey. She practiced OBGYN for 13 years, serving as department chair at Southside Medical Center, the largest community health center in the Southeast. In order to expand her scope of practice, she completed a second residency in family medicine at Morehouse School of Medicine. She was then appointed assistant professor and director of the maternal child health division there. She went on to Gwinnett Medical Center, where she helped to found the family medicine residency program and served as director of medical student education, as well as of the women's health program. In 2014, Dr. Booker's then fiance was diagnosed with stage 4 lung cancer with brain metastasis. They married and he succumbed 71 days later. The lessons learned through her grieving process have been cataloged in her new Amazon #1 best-selling book, 71 Days: How to Say Goodbye When Death Says Hello. Turning grief into sadness, Dr. Booker revamped her career and herself. She is currently practicing urgent care at the Wellstar Health System, but now her favorite titles are Grandmommy, World Traveler, and Avid Crocheter. She has 3 beloved grown children and 2 delightful grandsons, Trey and Hunter II. Her passion is the transformation of the social mores and fear around the subjects of grief and death. Her belief is that the transcendence of thought around these issues will reduce suffering with far-reaching benefit, giving humanity access to happiness in its first cousin, joy, at a level not yet imagined. Life is meant to be lived in abundance. We are called to stand showered in the overflow. So these are principles that you live by. And having met you before our conversation and just having the opportunity to speak with you briefly before we started recording, I'm so excited to speak with you. And I wanted to share your complete biography with everyone because I think it attributes to your passion behind your career path and just the way that you approach everything. So I want to welcome you to Style and Conversation, Dr. Booker.
I am so excited to be here. We go to church together. So we're church sisters. So when you called and asked me to participate, and the idea of preparing women for what is going to be their adult life from 30 and on is just fantastic. It's such a necessary conversation to have. And thank you for having me, Jessica.
It is a very necessary conversation, and I want to give the listeners some backstory on how we met. So we, like Dr. Booker said, we attend the same church.
And the Faith Center.
Yes, in Tucker, Georgia. So everyone who is looking for a church home in the Atlanta area to worship in person, or if you're not in the Atlanta area, we welcome Faith Nation partners. Definitely tune in. It has been life-changing for me. As you can see, I wouldn't have been able to meet Dr. Booker. And she spoke at the family conference that we had last year. And she had a complete topic for women's health. And We'll get into it with some of the questions about some of the things that she said that resonated with me, but that is how we met. And so I was just so intrigued to speak with you because of the passion that you spoke with about these topics, to help ladies after they're 30, and particularly Black women and women of color, because as you know, our health scope is vastly different. So I want to have
Okay.
this conversation.
Excellent.
And so I will jump right in with the first question, which was covered somewhat in your bio, but I want to give you the full range to cover this. So, what exactly inspired you to join the medical field?
I don't think it's in my bio, but my dad also was a doctor. And I remember him bringing home all kinds of models of stuff. I remember one was a model of the eye, so you could take off and look at the nerves. And one was a model of a foot. You could take off the skin and see the nerves and the veins and the muscles. And I just found it fascinating. How does the eye work? How does the information get to your brain? I just remember being very small and being very curious. And then we had a family friend who had sickle cell disease. And sickle cell is a disorder of the blood. It most commonly affects people of color, Black people of African descent. And we had a family friend who had a lot of problems, lots of painful crises and complications, and in the hospital. And I thought, oh, I could, go into that. We need someone to help and research that. But it was when I was pregnant with my daughter and in labor that I decided to do OBGYN. I really saw how there was such a difference between the way the men treated me and a way that the women treated me, and the sisterhood of birthing that was just felt like it was a team effort, and like everyone was so proud of me. What I was doing was such a big deal, and I thought, well, we need more women doing that. So that's how OBGYN and medicine came for me.
And so, what I love hearing you say that, I want to pivot for just a moment before we get back to specifically the medical questions. But what I found interesting, because this series is titled 30, Flirty, and Thriving, I don't want to assume your age when you had your daughter, but I do want to touch on the fact that you started this career path after you had your children. And so, I think a lot of people, I've been guilty of this too, thinking, okay, I'm at a certain point in life. I need to just stay on this certain trajectory that I originally had planned for myself, whether it was working or not.
Oh,
And
wow.
I want to touch on that for two reasons. One, because I think it's just, I want to hear your story, but also I think pursuing happiness, joy, and fulfillment adds to our overall health. And so I just find that interesting that through that experience of giving birth to your daughter, that you had this pivotal moment of just making a major life change.
That's right. That's right. Well, I was 19 when I got pregnant with her
Mhm.
and 20 when I had her. And I was in my junior year of college, and I quit school at that time, and was pregnant at 20,
Yeah.
and was working. Huh, Wow, I'll say this. I lived in a home for unwed mothers. My mom was very disappointed, I guess I'd say.
Hmm.
And I don't know if they have those anymore, but this was in 1983.
Hmm.
And it was through Catholic Charities. And there were about 20 women that we all lived together. And they helped us put our lives together. A lot of the women there gave their babies up for adoption, but there were those of us who were going to keep our children, and we had parenting classes, and we worked, and we did chores, and we really bonded together what could have been a very difficult time. I At that point, you didn't have to have a bachelor's degree to go to medical school, so I have no bachelor's degree, and I went to Meharry. um, Very, very, very interesting question. So it was very pivotal. At the time that I was pregnant with her, I thought that medical school was going to be impossible. I remember my mom telling me, we reconciled, of course, after I had the baby. I came home and stayed with her. And she said, I'm not going to let this baby steal your dream and have you resenting her. No way. You at least have to try. So took the MCAT, and my grades were good, and letters of recommendation were great. And Harry said, come on. And did it in 4 years. Couldn't have done it without her. I cannot say that it was easy. I've
Hmm.
always been an A student, and raising a daughter on campus and being in medical school as a single parent, I was single, was difficult. So I was passing, and I probably ended up in top third of my class after the clinicals. But those first 2 years academically, very, very difficult. And I was committed to raising my daughter on campus because I knew if I'd given her to my mom to raise, then she wouldn't really be my child when I finished. And I wanted to be her mom. So yeah, wow, I wasn't expecting that question. That was really good.
No, to
Really
be
good.
honest, I want to be honest with our listeners. I wasn't expecting that either, you all. This is a very authentic, flowing conversation that you're hearing. This was not on the list of questions.
Yeah.
I just, with Dr. Booker sharing her heart and her story, I just wanted her to give her the opportunity to expand on that because I feel like that's so interesting. And I'm glad that you actually did because my next question, which this genuinely was not on the list, your time at that home, how do you feel that that had an impact on, I know your experience birthing your daughter inspired you to pursue becoming an OBGYN or studying that. I don't know the
Mhm.
terminology,
No, you did it
but
right.
oh, okay, thank you. Your time at the home, did that, and being around all of those women going through a
Oh
similar
my
life
gosh.
moment, did that have an impact as well?
I think what was so great about being there, I think that when you have an unplanned pregnancy
Right.
and you're not married and all of the things that go around that, having other women in the same situation made it so much easier. I didn't
Mhm.
have to worry about any shame. I didn't have to worry about, what people were saying. And, it's more commonplace now. My daughter's 40. She was born in 1983. So it was different back then.
Mhm.
And, it felt limiting. I'll be honest with you. People in my own family didn't think that I was going to continue even to get my degree. That, once you have a baby, that your life is over. You're going to end up on welfare. You're going to work up, you're going to work hour wage jobs and you're going to, maybe eke out a very modest living. But I believe that that sparkle, that little zing in my head that said medicine, I know God put it there. And I now even talk to my students about that whole story. I tell them the whole thing. Don't tell me what God can't do. If it's there, there's a way. And I always say this too, one well timed no turns an OBGYN physician into a Burger King manager. One
Mm.
well-timed no turns an NBA player into janitor in an elementary school. And there's nothing wrong with being a Burger King manager, and there is nothing wrong with being an elementary school janitor. There's nothing wrong with that. But you know how when you're little, you have these dreams in your head, these dreams of what you're going to be and what you're going to do. And I believe God puts all of those dreams there. And then we've got to hold that dream out in front of us beyond all of the difficulties that come and
Yeah.
be willing to navigate around and through and over and under all of them in order to reach that, because everybody doesn't make it to that pot of gold at the end of the rainbow. But I believe everybody has that pot of gold at the end of the rainbow in their heart. So
Yes.
one well-timed no, one distraction, one, please say yes that turns into a no can steal your dreams away if you don't really understand that these dreams are destiny. This is no joke. This is no accident. You're intended to do big and great things in this life. And, we've got to believe that. We've got to understand that there's going to be difficulties and strongholds, but that, truly it's a faith walk, that we're intended to do great things. And you can do great things as an elementary school janitor, and you can do great things as a Burger King manager. That's not what I'm saying.
No, no, 100%. I'm following everything that you're saying, and I agree. You can do great things with all of those professions. It's more about what your path is and what the purpose is for your life, because that could be your ministry, being the Burger King manager.
There it
That
is.
could be your ministry. Just being the janitor, and it's just I that's really, I'm trying to find the words because I really am. Again, y'all, this is not the
This is
trajectory we
not where
had
we
for this
thought it was going to
conversation, but
go.
no, I'm just really blessed by what you were saying, and I promise we're going to get back to the questions. But I'm really inspired by it, and I remember there was a sermon that Pastor Campbell taught. I can't remember which series, but I remember him saying just how it is in his will and God has abundance and all of these things destined for us, but he doesn't show us the path and the adversity that we will face on that journey, because some of us we would punk out. And I'm so intrigued by you, and you're just in for a treat. So
And
with
listen,
that,
you know what? I love that we're flowing.
yes.
I love that. That's what, honestly, I think that's what everybody wants is
Yeah.
speak openly and honestly, no canned answers, be
Yes.
yourself, in an interview or in a situation like this. Say what comes to heart. I stopped and I prayed, God, do I tell it? It's like, tell it. Encourage
Yes.
someone. Encourage someone. There is someone who just had a baby or has just found out they're pregnant, and they have decided that that means that this dream that they've had is over. No, it's not.
It's
That
just a
means God
great
intends for you to have a baby and be a doctor, have a
yeah.
baby and have a baby and have your dream.
Because for you, it's like one of my favorite sayings, if I changed anything, it would change everything. So had you not gotten pregnant with your daughter, you wouldn't have realized this passion that you had and met these women in this home that really, I'm sure, inspired you, and you formed a sisterhood. Which, by the way, I don't know if you could tell by the shock on my face when you said 1983. That wasn't that long ago. So to hear that it was still like this taboo and there was a stigma around it, it's it's just very, very interesting. But I'm very grateful that you and your mother were able to reconcile and have that beautiful relationship, and you were able to meet these ladies that contributed to your path, and
My
you're here
mom
now.
was my mom was my birthing coach. I remember going to birthing classes with her, practicing at home. I did natural childbirth with my daughter at 20, and it was fascinating and fantastic. I have delivered over 10,000 babies in my career. And to think that I'm going to my 35th reunion for medical school next month. I've got babies that I delivered that are 30 years old right now. It's crazy. There are babies I've delivered that I know. I delivered one of my patients, so delivered her mom, and then the daughter got pregnant, and I delivered her. I mean, it's been amazing, and there's nothing like being the very first person to touch a brand new being,
What? I
to
never
watch
thought
them
of it
take
as
their
that.
first breath in your hands. It's phenomenal. I haven't done a delivery since 2017, and it really still just it's moving.
I never thought about that aspect for a doctor, that you are there when life enters the world, when they take their first breath.
I've done the Kunta Kinte many times, holding that baby up and saying, "Behold, the only thing greater than yourself." Like
Oh,
as that, as the person who ushers them into this world, really giving them to God right there in that moment. It was phenomenal.
I just okay. So what I'm going to do, I'm going to make another pivot because we're flowing.
Go.
So this is health related. So for ladies that are in their 30s and experiencing pregnancy for the first time, we hear a lot of things that, and I want you to keep me honest with this on the medical terminology, but from my understanding, after the age of 35, it's considered to be a geriatric pregnancy.
How funny that is! Exactly. They call it elder. If you look it up in the coding books, it's called elderly gravida.
Oh, okay.
Over 35 is considered elderly. We call it advanced maternal age as doctors. We call it
Okay.
advanced maternal age. And
Okay.
that's because at 35, your risk of having a baby that's chromosomally or genetically abnormal increases over the baseline population.
Okay.
That's why 35 is so pivotal. The chances of it still happening, people act like it's, half, 50%. It's still very, very low. But we
Okay.
know that, of course, then your eggs are older, so therefore you have a chance of having more mutation, and you have more chance of having a baby that is genetically not normal. Of course, there are these babies that are born that are genetically not normal, and they go on and live great lives and do great things. But genetically not normal that risk increases over the age of 35.
So, having that information, what are some things that you encourage ladies in their 30s that would like to carry a child themselves and have a healthy pregnancy for themselves as well as the baby? What are some things that
Great,
you encourage them
great,
to do?
great question. So a lot of women are what we're doing what we call delaying childbirth.
Right.
So women are in college or they're doing their career, they're traveling, they're married, but they want to wait to have children.
Right.
And so now they're waiting after 30 to do that. The risks of that are they could have an unknown pelvic infection, and then that means that the tubes themselves could be damaged.
Oh,
They could actually have what's called premature infertility, where they lose the ability to make an egg every month prior to the age of 35. So there's things that can happen in this delay of fertility that can just happen because your body's doing what it's doing, and unbeknownst to you, you become an infertility patient. So infertility is a little bit higher in
right.
women over 30 because they've delayed. Another thing that we're talking to a lot of women about is once you get to 30, it might be a good idea to harvest eggs. Then you have the best quality eggs. And as you
Okay.
go forward, now, of course, that's talking about harvesting an egg, freezing it and storing it, then you doing IVF, and then having that baby implanted. So it can be costly. But I have a lot of career women, professional women who are starting to harvest between 29 and 32, right at about 30 years old, because they either haven't found their partner yet or they're not ready to have children. And so we're talking about harvesting. I know that goes a little bit beyond what we decided to talk about as well. I had my last child at 34.
Okay.
And one of my tests, they do genetic testing while you're pregnant, came
Okay.
back that he had an increased risk of Down syndrome. Down
Okay.
syndrome is a chromosomal or genetic abnormality. And I ended up having the amniocentesis, where they stick the needle in your belly and take fluid off and do genetic testing on it. And he ended up being perfectly normal. But I've been through all of that, the scary part, the, oh my gosh, is my baby going to be okay? And what am I going to do? I went through all that and then, of course, had no problems. But, definitely had that conversation knowing that I was older, that I was going to be 34 when he was born.
That's very interesting that you touched on all of that. And it is good to know that now women do have options. I consider myself to be in that boat. I'm 32. I don't have children yet. I do desire to be a mother when the time is right. So anytime I'm able to get this information, it's always helpful. And I know there are women listening that are in a similar boat as well. So another question I want to
Yeah, I want
ask.
to. I want to say one thing before you go on.
Yes,
I don't
yes.
want people to feel like it's unsafe or unhealthy to have
Mm-hmm.
a baby after 35. For us as women of color, as we age and are pregnant, I know you wanted to talk about the maternal mortality issue. The
Yes.
older that we get, the more likely we are to have complications.
Okay.
So if you're going to delay childbearing and you're thinking about pregnancy after 35, I want you to be the very best incubator you can possibly be. You come in there with high blood pressure, diabetes, either on medication or not on medication, come in there obese with a BMI greater than 25, your increased risk of preeclampsia, which is high blood pressure of pregnancy, increased risk of diabetes of pregnancy, increased risk of premature delivery, increased risk of cesarean section. So the deal being over 35 is not just genetically, but
Mm-hmm.
also what happens to us and what happens to women as they age and get pregnant. So you want to walk into pregnancy as absolutely healthy as you can possibly be. One of my good friends, it's in my chapter of sorority, had her 50th birthday party, y'all, while she was 7 at her baby shower. She had a baby shower and her 50th birthday party, and that was her second child. She had her first baby at 48 and her second baby at 50, naturally occurring. So don't tell me it can't happen. It can happen. I've got plenty of women that have their first natural occurring pregnancy over 40. The issue is being healthy and being willing to be on a very, very strict regimen of your diet and exercise, keeping your weight down, watching that blood pressure because you're in a higher risk category. But don't say you can't do it. You can. Just be sure that you're making choices that are going to make you a healthy incubator for that baby.
I love that. So one, shout out to your soror, because that is one hell of a 50th birthday party, right?
Come on.
I mean, like, talk about a celebration. And I imagine that, by the time she was able to do it, and, I'm glad we're having the conversation around the the risk and the things to be mindful of surrounding delaying pregnancy. But I imagine that the positive is that at that point she was ready and able to be a fully just commit to motherhood and embrace it. And she had the wisdom, I'm sure patience, a lot of knowledge. And I also want to add the best resources to give her children so they could have the best life, education, access, all of these things. So it was
Absolutely
positive from both
planned,
sides.
absolutely planned for. She and I
Mhm.
laughed though. She's going to be ready to retire when it's time to teach him to drive.
I love it.
But
I
yeah,
love that.
yeah,
And may I ask if it's not too personal? I imagine both of her pregnancies were healthy.
perfectly healthy. And she went into the pregnancies as a healthy woman. She knew the risk.
Right.
So she went into the pregnancy healthy, and she went into the pregnancy understanding you can't do the I'm eating for two. You can't gain 50
Mhm.
pounds.
No.
That's going to put you more at risk. So yeah, but perfectly healthy. Really great.
And since you mentioned that, that'll actually help us segue into the next question. So I know you mentioned, a regimen of diet, exercise, managing a stable weight, also managing, this is not something that you mentioned, but I do want to touch on managing stress and embracing things that bring you joy. So what are some things that leading up to 30, as well as once you're in 30, that ladies should be focusing on? And like, what are some of the metrics that we should be focusing on? What should these numbers look like?
Well, okay, let's talk about that. That's really, really good. Let's just start with blood pressure.
Mm-hmm.
Okay. Everybody knows that 100 and let's talk about what blood pressure is first.
Yes.
Blood pressure is the amount of pressure that's on the inside of your blood vessel that the blood is pushing out against the wall of the blood vessel, how high that is.
Mm.
Think
Okay.
of it like the hose in your yard,
Okay.
and think of the spigot at the house as being your heart. So if there's a lot of pressure out in the hose, I got to turn that spigot on higher in order to get water to push through and water my garden as hard and as fast and as far as I need to do that.
Okay.
Okay? So if I narrow down that hose, that pressure that's going through there and the amount of pressure, I've got to turn that spigot up in order to get that flow where it needs to be. It's going to be harder, and it's going to be harder for that spigot to push against that narrow hose. Same thing with your heart. If the heart didn't mind pushing against a higher blood pressure wouldn't be an issue. High blood pressure unto itself, not a big deal. But the high blood pressure, the problem with it is how hard the heart has to work so that you can go into heart failure. And then when the blood vessels are small in your brain or the blood vessels are small around the heart, that then is a heart attack and a stroke, if that makes sense. Okay?
No, that makes perfect. And I want to let you finish, but that's something as a very non-medical person, I didn't even have that layman's understanding of blood pressure. So I'm glad that you broke it down that way for the listeners.
Good. We always talk about there's a top number and a bottom number. Top
Mm-hmm.
number is called systolic, bottom number is called diastolic, just for medical stuff.
Mm-hmm.
The top number is telling us what's the pressure on the inside of the blood vessel when the heart is pumping. The bottom number is telling us what's the pressure against the blood vessel when the heart is relaxed. So we know that a heart beats and relaxes to fill with blood, beats and relaxes to fill with blood, beats and pumps and relaxes to fill with blood. If your heart is beating faster, that means it doesn't have as much time to relax and fill with blood. When you're an athlete, let's say, has a nice slow heart rate, that means that heart is getting its maximum pump, getting maximum filling. That's a good, healthy heart. As you get a little bit older, your heart rate can be a little bit faster. And if you're in failure, it can be very fast, or arrhythmias, where it can be extremely fast. Okay. So the top number, we say you have high blood pressure when it's 140, and the bottom number is 90. That's our goal for people that have high blood pressure, is to be lower than 140 over 90. Making the diagnosis of high blood pressure now, we have lowered that. We now consider people to have stage 1 hypertension if their blood pressure is 130 over 80. And we
Okay.
backed that down so that we could prevent heart disease in people going forward.
Okay.
We realized, and what we found is the reason they did it is because if you have a blood pressure of higher than 130 over 80, between 130 and 139 over 80 to 89, they say that untreated with no changes, you will have straight up hypertension in 2 years. Now that's scary. 138 over 89 is stage 1 hypertension. You may not need medication, but if we don't do anything about it, within 2 years, you'll be straight up 148 over 98. And now you've got high blood pressure, your heart is under stress, you're at increased risk of heart attack and stroke and all that stuff. So we're looking for a blood pressure lower than 130 over 80 as being normal.
Okay. And so what I want to do, that's really good information. So I want to break it down as much as possible for our listeners, for someone who may not have the knowledge of contributing factors to high blood pressure.
Absolutely.
What are some of those things that contribute to high blood pressure?
Okay. We're just going to talk about it straight up, right? Let's talk about obesity.
Mm-hmm.
All right. It's important that when we talk about obesity clinically,
mm-hmm.
we are not fat shaming.
Right.
We have got to separate out those two. We have got to separate out those two. Let's even take it further. Obesity, fat shaming, and attractiveness. They have nothing to do with one another. Nothing to do with one another.
Mm-hmm.
All right. So if I'm talking about obesity, I'm talking clinically
right.
about how much fat is on your body. I'm not calling you fat. I'm not saying you're not beautiful. I'm saying clinically you are obese and have a higher fat content than what the studies have shown is healthy for you to have and maintain a healthy lifestyle that's going to provide long life and long life in a healthy way. So obesity for sure, because when you have fat on your body, you have then fat on the inside around your organs. You have then fat on the inside of your blood vessels. We used to call that hardening of the arteries. And that hardening of the arteries puts increased pressure against the wall. So obesity for sure. Mm-hmm. High salt content. So food choices. If you're eating McDonald's, Popeyes, processed foods, frozen foods, pizzas, stuff that you can throw in the microwave every meal. Mm-hmm. The way that foods taste good is they're savory, that means they're oily, they're sweet, and or they're salty. Buttery, savory, oily, sweet, and salty. Those things are going to make us go back to them time after time after time. And once you start eating that way, a salad with a lemon juice and some vinaigrette dressing is not going to taste good to you. It's going to taste bland. So definitely diet, because what does salt do? Salt concentrates your blood. The consistency of blood that is normal is, say, like red wine, kind of like that, that kind of consistency, not like water. When you get dehydrated or you get more salt inside the blood vessel, think of it more like ketchup. Which is easier for your heart to pump against, ketchup or red wine? Mm-hmm. Red wine is much easier. So water intake. Water intake also is important to stay hydrated because it protects your kidneys from kidney disease. And I should have said that. High blood pressure affects your heart, your brain, your kidneys. It can affect your eyes. It can affect the small blood vessels, amputation, stuff like that. But the big ones we call cardiovascular are going to be your heart attack and your stroke, and then kidney disease. So we talked about obesity, we talked about food intake, and we talked about hydration. Let's just leave it with those three. And then, of course, exercise is really good for you. I have a friend I just spoke to, and we started talking about high blood pressure and exercising. Mm-hmm. I tell my patients, if your blood pressure is uncontrolled, you don't need to exercise until it gets under control.
Mm-hmm.
because now you're asking your body to work even harder and lift and run, and your heart is already stressed, beating against a high pressure.
Okay.
So, lifestyle includes what you're eating, your hydration, your exercise. Then also we talked about obesity, like where your body is, and talking about weight loss. And then we talked about really salt content, exercise, lifestyle. So that's really where approaching 30 or being 30 makes a difference. So I'd say everybody at 15 wants to learn to drive at 16. And then at 16, you want to turn 18 so you can be considered, you can vote. And then at 18, you want to be 21 because now you can drink. Well, now you're 21 and you're an adult. So you spend from 21 to 29 having a blast and being a grown up.
Mm-hmm.
Well, now at 30, you now go to the doctor and your blood pressure is 135 over 85
Mm-hmm.
because you've been having a great time. At 40, that's when I think people start really saying, oh my gosh, I've gained, 50 pounds since I finished high school, or my blood pressure's up. At 40 is where people start ending up on medication that's going to treat this adult lifestyle they've been doing for the last 10 years. And now their body's actually feeling it. So
Mm.
at 40, you actually start now having to dial back all of the choices you made between 10 and 20 and 39 and 39. Those 20 years where you're wanting to have fun have turned into at 40 and above. Now you're on medication. You've got to, push away from the table. You're on a bunch of meds. You now have to start exercising. Now you're looking at your life saying, oh my gosh, my life is shortened because of the choices I made in my 20s and my 30s.
I want to be honest. I appreciate the transparency in this conversation. And Dr. Book already said this, but I just want to repeat this. We're not shaming anyone for weight, life choices. We're having a transparent conversation because life is meant to be lived in abundance. And so that is the purpose of this conversation. So I want to encourage any of our listeners that are in their 20s, approaching 30, again, enjoy life, but within moderation. I mean, do we need to have Tequila Tuesday every Tuesday? Probably not. Does it need to be Wine Down Wednesday every Wednesday? Probably not. If you're smoking, definitely do away with that because that adds to high blood pressure. If you're not exercising, I would definitely encourage you to start that regimen now. So when 30 hits, your system isn't at a shock and you don't have these issues that Dr. Booker is speaking about. So that's very interesting. I never understood that timeline from a doctor's standpoint that you all see in patients where it's like in my 20s I was living it up
All the
and
time.
then 30 hits and it's like you go to the doctor, you have high blood pressure, and then 40 it's like I want to take it seriously, which you have breath in your lungs. Yes, you should still take it seriously, but it's better to focus on preventative measures so
And
you can
I'd say
avoid.
this. How about this? What if you did Tequila Tuesday that week, and that's the only vice that week. You're still exercising. Let's say you
Mm-hmm,
decide you're going to do Wind Down Wednesday the next week.
mm-hmm,
Okay. And let's say that on the day of your birth, my birthday is the 21st. On the 21st of every month, I go out for a sumptuous meal
mm-hmm.
once a month.
Yeah.
Or if I know I've got a birthday coming up or I've got a vacation coming up, I'm acting really, really, really good for those other 3 weeks because I
Right.
know that 4-day weekend, I'm going to be turned up and having a great time. That means that I've got to treat my body in a way that says, I want to live a life of overflow. That doesn't mean I'm never going to have a glass of wine. That doesn't mean I'm never going to go and have a party with my friends. It doesn't mean that I'm not going to go and have a great meal. But I can't have pizza every day. I can't have processed food 3 times a week. I
Right.
can't do that. I'm 61 now. 61. Just did a serious something called the 40-day turn up with very,
Mm-hmm.
very strict eating and water intake, and lost a significant amount of weight in these 6 weeks, and off my diabetes medicine and all that. I don't want you guys to have to do all these seriously stressed out measures in order to turn back to get your body back to a place of health that I now I really want to hold on to. It's been great. It's exciting. I did it, but I don't want you to have to be in that position where you're 35 pounds overweight, you have high blood pressure, diabetes, and your doctor says, okay, I'm going to give you 3 months to take off 10 pounds. And if I see the weight coming off, we can hold off on the medication.
Mm-hmm.
While you're holding off on the medication, you also can't exercise as hard as you can because your blood pressure is not under control. So, I'm just saying, I want you guys to live a life now. Put structures in place, put a schedule in place that allows your health to be first. I say now, I want to live the second half of my life as if I learned something from the first half. So I want to teach you guys, plant these seeds in you guys now. So when you're 60, you're not saying, oh my gosh, I'm on, 3 meds I'm trying to come off of, and I've now got to, really step it up, and I've got bad knees now and I can't exercise. I want you guys to be exercising, weight bearing, protecting your joints, protecting your heart, making sure you don't have diabetes, and living a reasonable and abundantly fun and joyful life.
Yes. And all of that, it's just very interesting to hear like the cycle of, of life, and then 40 hits and it's like, okay, now let's do something. So I'm glad that you're sharing this with people. One nugget that you dropped that I really want to expand on really quickly. So if you have a patient that has high blood pressure, I know you said you don't encourage them to go and like join Orange Theory right away, because you're not saying don't ever join right now because your blood pressure is not manageable. So that's new information for me. So what would you encourage them to do instead to incorporate exercise into their regimen, because that does attribute to lowering their blood pressure?
All right. So if you have high blood pressure and you want to do any exercise, I tell people, I want you to have a gentle walk around the neighborhood at sunset with your wife and kids. I want you to be gentle. I don't want your heart rate getting up to 120.
Okay.
An easy walk until we get your blood pressure under control. Some people say, well, my blood pressure's up, I need to go exercise so I can bring my weight down. Let's do the weight loss with diet control, not a diet, but with lifestyle, with reasonable eating. Let's get the weight down with food, and do a gentle and easy walk around the neighborhood. You can do that every day. You can do a gentle, easy walk around the neighborhood twice a day. And that will help because you're going to be moving your muscles. But I would love to see weight loss in people that are hypertensive, not on medication, wanting to bring that down. Do that with reasonable eating, gentle walking, and then have your pressure rechecked. If it's coming down naturally with the weight loss and the gentle walking, and now you're back in normal range, and you want to kick it up a little bit, that'd be great. And I mean, keep your Apple Watch or your Fitbit or your smartwatch so you can be monitoring your heart rate, so you can make sure that you're not doing anything that's overexertion. I mean, I love my Apple Watch and what the information it gives me. I can hit this thing on my home screen of my watch. Heart rate is right there. I just touch it and I can check my heart rate at any time. I can track my resting heart rate to make sure that I'm as healthy as I feel. So absolutely, Fitbit, Apple Watch, Samsung Watch, a smartwatch is a really great idea for fitness.
I agree with that. So I want to ask you, what are some ways that high blood pressure affects women in particular? I know one of the things we talked about was if you are a woman who does have the desire to be a mother and you choose to delay pregnancy, that is one way. What are some other ways that high blood pressure affects women health-wise?
So, the February is Women's Heart Health Month, because really most of the research that's been done on most diseases is done on men, and it's done on white men. So we're realizing that women's presentation of heart disease is different from men's.
Okay.
So a woman might have a sense, right? A woman, we call it atypical chest pain. The chest pain we talk about with a heart attack is that chest pain right in the middle of your chest, or maybe a little to the left. Feels like there's an elephant standing on your chest. You just can't catch your breath. Maybe some involvement going down your left arm up into your jaw. That's classic heart attack pain. For women, we might have what feels like indigestion, nausea and vomiting. We might feel like it's heartburn. We might feel, so that kind of thing. So if a woman is, let's say, I'd say 40 and above, heart attack in a 30-year-old, unless she's obese, and she's talking about indigestion, or she's talking about a sensation of burning in her chest, she's getting an EKG in my clinic. Even if her blood pressure is normal, that can be a blocked artery. And that blocked artery can't, it can come rarely from something other than high blood pressure. So be thinking about that. Definitely, high blood pressure in women specifically can be affected if they want to bear children. So if you have high blood pressure at 35 and you want to get pregnant, we have to have you on certain medications when you get ready to get pregnant. A woman who has chronic disease needs to be on good birth control. An unplanned pregnancy on certain high blood pressure medicines, certain diabetes medicines can put that newborn, that very first 3 months, the first trimester baby, at risk. So if you are on medication right now and not using birth control, you definitely want to be on birth control, because people with chronic disease need to plan their pregnancies. Unplanned pregnancies and high blood pressure on meds can be problematic.
I'm glad you educated on that. Just, I want to ask one question. Can you educate us on what an EKG stands
Oh, I'm
for?
sorry. Okay,
No,
an
you're
electrocardiogram. You've seen it where they put all these leads, we call them, these
yes.
stickers all over
Okay.
your chest, and it'll
Yes.
show the electrical pathway of the heart. And
Right.
there's certain patterns that we can see on this strip. We call it on a piece of paper that'll let us know whether there's been damage to the heart, whether there's actively there's someone's having a heart attack, how fast the heart is beating, if there's something called an arrhythmia where the heart is either beating too fast or too slow. It kind of tells us what's going on with the heart electrically. And it's the number one way that we can say that, yes, this is a heart attack happening right now or not. So an EKG is something I can order, and it's about this long. It's only about a few seconds of the what's called a rhythm strip, but it shows me what the heart is doing electrically, and certain patterns can make certain diagnoses in the heart. So that's what an EKG is. Good question.
I'm glad you educated us on that. And I want to take a moment because we spent some time talking about how to prepare ourselves leading into our 30s. And then once we're in our 30s, how to prepare ourselves for good health in our 40s. I want to take a moment to shout out our sponsor. The sponsor for the first season of Style and Conversation is a company called Vita Authority. What you see here is one of their powdered collagens. I have been a customer and consuming their collagen for over a year and a half now. I have seen great results in my hair, my skin, my nails, my energy. This collagen actually includes hyaluronic acid and vitamin C, which is very important for collagen support. And these are just essential things for our body that we need. So to tell you all a little bit more about Vita Authority, Vita Authority believes everyone should be able to take their health into their own hands, and we envision a future where health and nutrition products are found on counters in every single household. We pride ourselves on being an absolute authority when it comes to health and wellness supplements, and set the standard on providing high quality, science-based, clean, tested, and proven products for every person from every walk of life. Vita Authority can now be found at GNC retail stores as well as other retailers nationwide, and has gone international in Canada, the Dominican Republic, Panama, the Caribbean, and Africa. For more information about Vita Authority and our commitment to promoting women's health, wellness, and active lifestyles, please visit www.vitaauthority.com. That is spelled VITAUTHORITY.com. And I have a special treat for all of our listeners, because you all will receive 15% off when you enter the code Styled by Jess. That is STYLEDBYJESS. And some of their other products that I love, I have tried their essential probiotics, and I really love those. This is essential for gut health for anyone who may not have that information. And I also have tried their Melt PM. Sometimes, I have a moment where I may have too many things in my mind and I need a little help winding down in the evening to enjoy a full REM cycle of sleep. And so I've really enjoyed this, and I have found that this has helped me with my cravings, in addition to some other things that I include in my diet. But I can't recommend Vita Authority and their products enough, especially for ladies. So definitely check them out and take advantage of our code. So
I just wrote it down. I just stopped and
yes,
got a pen so I could write it down.
Dr.
Styled
Karla,
by
can I tell
Jess.
you? So once per year, so I naturally have always had long nails. I just have them short right now. I use polygel instead of acrylic. So it's applied the same way. It's just supposed to be better for your nails. And normally when I take them off, I let them take off the product and just cut them down, and I leave my nails alone for a few months. Normally, like my nails, they were still brittle when I got everything taken off 2 months ago. But I was looking at it when the nail technician took them off, and I was like, they look a lot healthier than they. And I'm like, what if? And I'm like, I stopped taking biotin because I've been doing laser hair removal. So I was like, it's not that, it's the collagen. Hand to God, I've been taking it long before they were a sponsor. And that was one of the reasons that I reached out to them, because I pride myself on not speaking about products that I have not used and I don't love. So I can't recommend this product, like all of their products, enough. Like, definitely check them out.
Fantastic. Well, I wrote it down, so.
Yes, and I will send it your way.
Mhm.
So something you said when we met at the family conference was, it was about insurance companies and pap smears.
Okay.
And so I want to really talk about this because there recently, I'm not sure if you heard about this, but there was an influencer that had a very untimely death, young girl in her 30s. She found out too late that she had cervical cancer. And so this ties into this topic and how we met. You spoke about this at the family conference, in that, insurance companies, and keep me honest on the facts, that at this point, I think this happened around like 2010. If you have a history of regular pap smears, insurance companies change their policy that they will no longer pay for a yearly pap smear. So you are essentially only having a pap smear every 3 years. And so with that, the problem that you spoke about is that as a woman, you have no one looking at your pelvic floor, looking within your vagina. And I just want you to talk. I want to give you the opportunity to talk about why that's important, and also share that you encouraged us, even if you are a patient who has regular pap smears, to advocate to your doctor and request a pelvic exam.
See, you just said it. You just said the whole thing.
Okay, doc, I had to make sure I said it correctly.
But
I was
it's
like,
good. It's super good. This is really good.
Yeah.
So it's not just really the insurance company, right?
Mm-hmm.
We started finding out so much about cervical cancer, and finding out so much about the HPV virus, human papilloma virus, that causes it. Very slow growing. Once you have a precancerous area on your cervix, how long does it take for that precancerous area to become truly cancer? It's a very long time. People, if you have a low grade or mild precancer, healthy women clear that on their own. We just have found out so much information about HPV and cervical cancer and the relationship between the two. So we started realizing that you don't have to sample the cervix every single year. If your pap smear is negative and your test for HPV is negative, we do both of those on a pap smear, then you can stretch that out to every 3 years. If you do the pap smear, I'm sorry, every 5 years if you do the HPV. If you only do the pap smear part, just the scraping, looking at the cells on the top, then you're going to get a pap smear every 3 years. Okay. With HPV, you can stretch it out to 5 years. The interesting thing, though, is that people have collapsed a pap smear and a pelvic exam as being the same thing. They're not. A pap smear is a specific test that is done once that speculum is in your vagina. When I look at your cervix, I take a swab and a smear and I send that off to the lab. That is a pap smear. That is a test for cervical cancer. A pelvic exam is where I do an external look at the outside of your vaginal area, your personal area. I look around the rectum to make sure that there's no lesions or sores there, that you don't have any hemorrhoids. I look at the lips and at the clitoris and the inside and the opening of the vagina to make sure that everything is normal there. I put a speculum in the vagina and I can look at the walls of the vagina if there's any discharge. I can look at the cervix itself and see if there's any polyps or any lesions there. I can do sampling for sexually transmitted diseases, and I can do a pap smear. I take the speculum out of the vagina and I do what's called a bimanual exam, where I put fingers inside the vagina. I can feel the cervix. I can then examine the uterus, the tubes, the ovaries to make sure that there's no fibroid tumors, that the uterus is not enlarged, that there's not an ovarian cyst or a problem with the tubes. I can check all of that with the internal exam. If I wait 5 years to do everything but the pap smear, that doesn't make sense to me. As a gynecologist and a proponent and an advocate of women's health, I say the vagina is as important as the heart.
Yes.
The only reason that you get people listen to your heart every time you walk in the door is because it's so easy to get to. Right. I pull out my stethoscope. Your chest is right there. I don't have to take any clothes off. I can listen to your heart and lungs right there. But you're telling me that annually my vagina is not as important as my heart or my lungs? Of course it is. And most women aren't doing self-vaginal exams. They're not looking at with a mirror down there to make sure. They can't even see on the inside of their vagina or their cervix. So absolutely, a pap smear and a pelvic exam are not the same thing. And a pelvic exam should be done every year. It should be done every year. And as women get older, we go through menopause, we're not having babies anymore. They even stretch it out in their minds longer than that. You're more likely to have vaginal cancer, labial cancer, clitoral cancer as you get older, post-menopause, than you would when you were younger. And the only way you're going to see a vaginal cancer is someone puts a speculum in your vagina. So as you age, it's even more important, I'd say, that you're getting things looked at once a year. For younger women, we're more worried about sexually transmitted diseases and vaginitis, which is inflammation of the vagina with discharge, cervicitis, inflammation of the cervix with discharge. Those things can cause infertility, right? So that's why we're more worried about that when women are younger. As we get older, we do need to still be looking at that vagina, looking at the outside part and doing an internal exam to make sure that things are normal. Absolutely every year. That is not a pap smear. That is a pelvic exam.
So would you say that as ladies mature in age, that we're more prone to, which I'm going to be completely honest with you in this conversation, I didn't even know clitoral cancer was a disease. I'd never heard that prior to this conversation.
It's rare. It's rare, but it can happen. And you will miss it, right? You're not looking down there. You're older now. You're not thinking. You might have a little itching and think it's nothing. You might feel something and think it's nothing. Absolutely I think every year. Why not? If you're listening to my heart every year and I'm 61 or 70, why not take a look and make sure that everything's okay? Is it uncomfortable if you're not sexually active anymore and you don't have your estrogen anymore? Is it more uncomfortable? Sure. But it needs to be looked at. You would hate to have something bad happen because you just didn't want to be uncomfortable for an afternoon. It's better to look and know. That's preventive medicine to prevent untimely demise or untimely, bad diagnoses and bad disease.
So would you say that these cancers, as ladies mature, they go unnoticed because, like you said, maybe the discomfort of the exam itself, because you are of a certain age and our estrogen levels drop, and then just not thinking, okay, I'm past this season of life, I'm in the clear?
Exactly. And women don't know. Women don't know
I'm
those
being
risks still
educated
exist.
with the listeners right now. I had no idea this was a disease.
Absolutely. So I say a complete physical every single year. Absolutely, because of HPV, the pap smear can be stretched out to 3 to 5 years, depending on whether HPV has been tested or not. That doesn't mean that your personal area doesn't need to be looked at. Absolutely, every year, your vagina and your cervix are as important as your heart for the rest of your life.
And so for the ladies to be educated, what should a full physical exam done annually include?
Wow. Okay, let's be straight. From head to toe.
Okay.
That means you shouldn't have any socks on. We need to be looking at your toes.
Okay.
You can have circulatory problems that we only will see because there may be a little discoloration of the feet. You could have a fungus of your toenail. If your socks are on, we're going to miss that. So completely undressed, head to toe, looking at your eyes and making sure your pupils work, looking inside your ears, looking in your nose, at your throat, checking your glands, checking your thyroid, listening to your heart and lungs, doing a good breast exam, including squeezing the nipple to make sure there's no bleeding or discharge, checking under your arm to make sure there's no lymph nodes there, listening to your abdomen to make sure your bowel sounds are normal, pushing on your abdomen to make sure that there's no pain or masses. Checking your joints, all of your joints, elbows, your shoulders, your knees, and your hips to make sure that there's no clicking or movement, that there's no pain. That's going to tell you there's early arthritis. Checking your skin, then doing your exam. At a certain point, having a rectal exam and checking stool is something that still can be done. Looking for hemorrhoids around the rectum, looking at your skin head to toe, checking your reflexes, that's neurologic. So that's, and look how fast I said that. You could do
Yeah.
a complete physical outside of the pelvic exam probably in 5 minutes. The
Oh,
pelvic exam itself to me takes about 5 minutes if I'm not doing a drive-by, is what I call it. Taking my time, making sure I'm discussing it with the woman, letting her know what's coming next, making
okay.
sure that she's not uncomfortable, making sure that we're in communication during the exam. I think a good pelvic is 3 to 5 minutes because I'm taking my time and I'm talking it through with her. So that means a complete physical, including pelvic exam, can be done in 10 minutes.
Okay. So, ladies, Dr. Booker said this is annually 10 minutes. And should they have this exam done with a primary care physician?
Primary care. Yep.
Okay.
Your primary care can, when you're younger, your primary care is your OBGYN.
Right.
I think, and don't, I'm biased, I'm an OBGYN and family medicine doctor. I think that people who have been well trained in doing a pelvic exam, I don't have any problem with them doing my annual pelvic. Well trained. I don't want folks that are not well trained in that bimanual part. If you're not well trained in doing a pelvic exam, an internal part, you could miss that the uterus is a little bit enlarged. You could miss that there's a mass on the ovary. So for me, I believe truly, unless you are well trained in doing a bimanual exam, then that women's exam should be done by an OBGYN doctor who spends 4 years being trained. That's all we do. The whole 4 years is do bimanuals, the entire 4 years, so that we're very, very, very intimately acquainted with what an abnormal pelvic exam is like. So it could be a family medicine doctor, it could be an internal medicine doctor, but for me, my true pelvic, know that everything is absolutely stone cold normal. Why not do that with an OBGYN? And you still have your family medicine doctor. You can still have your internist or your internal medicine doctor, but the women's stuff, and of course they're going to send you off to your OBGYN doctor if anything's not normal. But that annual, every year, to make sure that that uterus isn't enlarging, that there's not a fibroid there, for me, that's an OBGYN doc.
Okay. I'm glad that you added that in as an extra precaution for ladies to do annually because that's very important.
Yep.
So I'm glad you mentioned that. So while we are on this topic about physicals, and I know we were just talking about like just the vaginal health and those exams, I want to pivot into um, the we touched on it briefly earlier, but the mortality rates surrounding Black women and childbirth. And so, my question to you is this has started to gain more attention. And it seems that unfortunately, as we advance with technology, which I attribute to better healthcare, which I want you to keep me honest with that. Maybe I'm wrong in that. It seems that the mortality rates are rising. And so I want to ask you, what are some things that as Black women we should keep in mind as we approach pregnancy and try our best to have a birthing plan, which can pivot? And what are some things that we can do to advocate for ourselves and that our family members can also do to advocate for us if we're not in a position to physically advocate for ourselves in these childbirth and post delivery moments?
Really good. So this is really about education. Now that the world knows that Black women die at 4 times the rate of white women, even adjusting for socioeconomics, you take a professional Black woman, professional white woman, same education, same career, live in the same neighborhood, with this everything the same, the Black woman is more likely to die, 4 times more likely to die. All right. It's a lot of things. We know there's systemic racism, there's systemic issues that are going on. When a Black woman says, I'm having a headache or I'm having severe cramping, it's not taken as seriously if we say it out loud. Another thing I'm noticing is that we minimize. I think that, we have a headache, and maybe the doctor's told us, your blood pressure is up a little bit. If you notice headache or blurred vision, if you start noticing you're swelling, I need you to call me and come in. Well, we've got some blood, and I've seen patients do this. They've got a headache, they've got swelling, and grandmama told me just lay down, take a goodies powder, and put my feet up. So that,
Yeah.
first of all, it's education. We need to know. Well, once we know, we need to act. That means that we need to go in for the slightest headache. We need to go in for the slightest swelling and let someone check our blood pressure, check our urine, dip our urine for protein, and make sure that there's nothing crazy going on. Okay. Another thing I'd say is preconceptual. We need to plan pregnancies. Unplanned pregnancies put us at even more risk.
Mm-hmm.
We haven't had our blood pressure checked, let's say, in a year, and it's high. Now we're pregnant. We're already obese, and it's an unplanned pregnancy. We're at increased risk for high blood pressure, diabetes, or pregnancy. So making sure that we're getting checked every year, we know what our blood pressure is, making sure that if we're not wanting to be pregnant, that we're using birth control so that we can plan our pregnancy and be the best incubator. Once we're pregnant, taking an idea, having that idea, if I'm having some cramping, and I don't want to just say that it's constipation. I need to go in and make sure that I'm not in premature labor. I've got to make sure that my blood pressure is not up and that the placenta is not separating. If we have symptoms, we need to speak it out. We don't need to ask grandmama. And this is another thing I have to say. I've had so many patients tell me, I said, well, did you call your doctor? And they say, well, it's 9:00 at night. The office is closed. This is an obstetrics practice. People have babies at 2:00 in the morning. What are you supposed to do? Not call and tell them you're coming to the hospital?
Right.
Every practice has to have coverage. I don't care if you're an endocrinologist or cardiologist. There is someone on call for every practice 24/7. Ophthalmologists have to have someone to answer that phone and send a message to the doctor that's on call. So it doesn't matter whether it's outside of office hours. If something's going on, we've got to call and ask, is this okay? And let that practice, and we need to take it seriously. If you feel like something doesn't feel right, and you put a call in to your provider and they say, oh, why don't you put your feet up and call me? I will see you in the morning. And you say, no, something is wrong. My feet look like sausages. Go to labor and delivery. Just go into the hospital. They will check your blood pressure. Once you get there, they have to check you out and make sure that you're okay. So make sure you know what the signs are. Swelling is not normal. A headache is not normal. My pressure was up last week. Maybe I should have a blood pressure cuff at home. I know that as a Black woman, I'm more likely to be sick and I'm more likely to die. Let me do what I can. Let me make sure I'm eating right. That's a conversation I'm really wanting us to have more at the very first visit. If you're already obese, you can only gain 15 pounds. If you're a normal weight person, you can gain 25 to 30 pounds. If you're obese, the suggestion is you gain between 10 and 15 pounds for the entire 9 months. How do you do that? Need a nutritionist. How do you do that? You're logging your calories. How do you do that? You're having a conversation with your midwife or your OBGYN each visit about what your weight is doing. Obesity is the number one cause of problems in pregnancy in all women, but especially in us as Black women.
I'm glad that you said those things because paying attention to the signs, being educated, those things are all important. And even the patients that just didn't think about the fact that there would be someone on call to take your call. And you covered everything, that even if you come across a care provider who says, oh, you're fine, just coming in the morning. No, pay attention to your body. If something's not right, you know how you normally feel. And just still go, because like you said, once you're there, then they have
check everything out.
Yeah.
And listen, I have to say this, my patients, I say this, I'm doing urgent care now, and I say this to my patients even now. Don't forget, I'm the employee. You're the employer. You're paying me. Your insurance is paying me. Your government insurance is paying me to make your dreams come true. You're paying me to make sure that you're better, to make sure that you're reassured, to make sure that you're on the right medication, to follow up those meds, to follow up your blood pressure. You are paying me. I think a lot of times people think because the doctor's smarter or the doctor's an authority figure, they don't want to disrespect them, they don't want to upset them. Upset me. I
Mm,
work for you. I'm here for you. You're not here for me. I had someone tell me this week, well, I mean, every time I leave the office, I still have so many questions. I said, then why did you leave? They can't drag you out of the office. If you're not satisfied with the visit, don't get up. Sit in your chair and let them come back in and say, Miss Booker, was there something else you needed? Yes, I actually had 3 more questions, but you were rushing me and you walked out the door. Oh, they'll come back in. What are they going to do?
right.
Drag you out? Tell you they're not going to answer your questions? Come on, advocate for yourself. You're not being disrespectful. And there's a way to talk to someone that they're not going to get upset. Oh, Dr. Booker, you just said something about, my blood pressure was a little bit high. What would be normal? What was the number? What am I looking for? Should I get a blood pressure cuff? Should I be checking at home?
Right.
It's okay, more than okay, because you're
Mm-hmm.
hiring me. You are paying for the information that I have. You are paying for me to counsel you. Yes, we're busy. Yes, we've got patients stacked up. Yes, we're running late. All of those things are true. But you are not to leave that office that you've paid me to take care of you and you're dissatisfied. You've paid me to take care of you and you have more questions that you're more worried than when you walked in the door. I didn't do my job.
I'm glad that you are empowering patients to ask those questions, to be transparent. I have definitely been in medical situations where I didn't feel like my questions were answered or my concerns were taken seriously. I do feel a lot more confident now to ask those questions, but I have absolutely been in those positions before where I didn't have a care provider that had the patience to slow down, give me a second to ask all of my questions. So it's encouraging to hear that, and I feel a lot more empowered to do that. And I, I want to, I'm going to make this statement and I want to hear your feedback. But also, if you have a care provider that isn't giving you those things, even after you've spoken up, then I just want to encourage our listeners to, within your means, seek another healthcare provider within that same, if it's an eye, ear, nose, and throat doctor, if it's a
Let me
dentist,
tell you
like,
this. Let me tell you this. If you have tried to advocate for yourself and what you're getting is eye rolls and someone looking at their watch and
mm-hmm,
they're not willing to give it to you, that's not the primary care doctor for you.
mm-hmm,
And there's surveys. Make sure before you leave, you want to say, I'd like to speak to the office manager
yeah,
and put your concerns and complaints in writing and tell the office manager that you won't be back. Because
mm-hmm,
I'll be serious with you, those conversations mean a lot to us. Put a Google review in. I hate to say
mm-hmm,
it. Now, maybe they were having a bad day. I
right,
understand that. If you always liked them before and this was a bad situation, give
right,
them
fair
another
enough,
chance. But
yeah,
if this is consistent and you're not getting what you want, you're not feeling respected, as the reason they're there, absolutely let your little feet do the talking and speak to the office manager and put a complaint in writing because that's not acceptable. And until we are accountable, we're not going to change. And I think there is a space for us as docs where we say, I'm kind of running this show and
mm-hmm,
I've talked enough and I've been in the room long enough. I try to communicate in a way with my patients that it's so collegial. It's such a comfortable woman to woman conversation.
mm-hmm,
I walk in the door wanting to be that. Sit down, ask them what I can do for them. How can I help is what I say when I walk in the door. Hey, I'm Dr. Booker. How can I help?
right,
That's really, how can I help? You're here with a concern or a problem. How can I help you? And that's sit right down on my chair. I'm not standing up. I'm not on my computer clickety clacking. And I'm saying there are some doctors that will do that. If you're feeling that they're not looking at you or they're not giving you say, I'm sorry. Would it be okay if you stop typing for a second so that we can have an interaction? I'm feeling a little dismissed. There's
right,
nothing wrong with saying that.
mm-hmm,
And they may say, oh, if I can type while we talk, I can get the chart done faster. Yeah, but I'm not feeling like I'm getting the time and the attention that I really need today. Do you mind? If they mind, that's not your primary care. So I'm going to empower you for whatever it is you need in that day. Maybe you're just in for birth control pill refill, and it's no big deal. There's no concern or complaint.
Mm-hmm.
But if I'm clickety clacking on the computer and you did have a complaint, are you more likely to ask it? Probably not.
I agree. I agree, guys. Be empowered. I'm loving our conversation. So I have just two more questions for you. One of them is medical related, and then one is a little more lighthearted. So for this question, I want to ask. So weight loss has always been, and I think will continue to be a hot topic of conversation. Within the last few years, there's been a huge buzz around weight loss drugs such as Ozempic and Mounjaro, just to name a few. So, what is something that you can tell us about these drugs, such as side effects? Who would be considered candidates for these drugs, and just are there benefits to these?
Okay. So these drugs, Mounjaro and Ozempic, are medications that are made for diabetics.
Mm-hmm.
It manages blood glucose. And the way that these drugs work is it works on the gut, it works on the stomach, it works on the intestines, it
Mm-hmm.
works on the hormones that are surrounding digestion, satiety, which means fullness, feelings of hunger. And what they do is, honestly, I was on Ozempic from September of 22. I
Mm-hmm.
just got off 2 months ago. I am a diabetic, diet controlled, but I
Mm-hmm.
was I was able to manage my diabetes without medication, but
Okay.
my weight wouldn't come down.
Oh, okay.
My weight didn't come down. I was able to, again, with what I was eating, I could manage the diabetes numbers, so I didn't need
Okay.
medication.
Okay.
But my weight was hanging out right at about 185. I'm
Okay.
5'4.5", 5'5". That's obese. That had me at a BMI of 30. So I talked to, I've got weight loss specialists where I work at Wellstar, and I talked to the obesity medicine folks there. And because I'm diabetic, I qualified for the Ozempic. And I did it nice and slow. I lost 25 pounds over the entire year,
Mm-hmm.
nice and slow. Ozempic is hard to get if you're not diabetic. And
Mm-hmm.
now that everybody and their brother is on the medications, it's very hard to get. Even for me as a diabetic, it'd be time for a refill, and no pharmacies had it. So people that are not diabetic are also being prescribed it and willing to pay for it. And so it's actually, they're having a hard time keeping up with supply. Okay. Side effects. Everything related, what did I say? It works on the GI tract, the gut, the stomach, the intestines. So you can get constipation, you can get diarrhea, you can get nausea and awful vomiting. Those are the big ones. And
Mm-hmm.
I never had the nausea or the vomiting. I did have the diarrhea and the constipation. I've had patients that had the vomiting so badly they came in for IV fluids and
Oh,
they had
wow.
to come off of it.
Okay.
So some people, and I'll tell you this too, I always had a sensation right here in my stomach of what we call medically dyspepsia. That's a sensation of like your stomach kind of griping or your stomach feeling upset. That was kind of always there. Just a feeling of, ooh, my stomach's kind of upset. Not a burning heartburn kind of a thing, but just a discomfort there. And it would
Okay.
kind of be like it was your stomach telling your brain, don't eat anything.
Ah.
So I could go the whole day. It might be 5:30 in the evening, and I haven't had a thing to eat and haven't thought about it.
Oh, wow.
So it actually gives you a sensation of early satiety or a sensation of fullness, so you don't have any desire to eat. And it also delays what's called gastric emptying, so your stomach stays full longer, so you don't eat. So it actually monitors how many calories are coming into your body because it takes away your cravings. It takes away just that basic thought of, huh, I haven't eaten since 9 o'clock and it's 12. It's time for lunch. It's time for me to eat. Noon, 1 o'clock, 2, 3, excuse me, 4 o'clock. Sometimes I'm telling you 5:30, the sun's going down, and my brain's like, oh, I haven't eaten.
Yeah.
So for people who comfort eat,
Mm-hmm.
people who graze all day, people who chips and fries, burgers and processed food, people who are morbidly obese, 250 plus, 300, 350, it makes sense. This is what I'm going to say. You don't see 80-year-olds that weigh 250. You just don't see it.
That is
Morbidly
a
obese
valid point.
people do not, they don't live to 80 years old. Rarely. That means you're limiting, truly limiting how long you're going to live. So, if you're a morbidly obese person, do I think the shot is the way to roll? Yes, I do. For a person like me, I was the most I ever weighed was 199. That was at 50 years
Mhm.
old. Did Weight Watchers, it worked. I did, stuff at work, accountability groups that worked. But what didn't work was the stress that came after it. I wasn't able to manage the craving.
Mhm.
So there's a psychology behind eating, a
Right.
psychology behind food addiction. That's food addiction.
Right.
I'm stressed, I'm in a bad mood, I'm cranky, I'm irritable, I need a milkshake, I need a Chick-fil-A sandwich. And after I eat that, I'm calm.
Mhm.
It's kind of like an addiction to alcohol or an addiction to drugs. I need it, I need it, I need it. I'm not myself without it. I give this thing to myself and then I feel better. I
Uh,
totally was a food addict. Totally. When I'm eating at work, I'm much easier to work with. In
yeah.
stressful situations, if I can, there's cupcakes back there for somebody's birthday. If I don't give that cupcake to myself, I'm mad and I'm irritable,
Yeah.
right? So I've actually, this new program I'm doing, this new lifestyle I'm doing called the 40-day turn up. We eat at a certain amount of calories every 3 hours for 4 meals. 400 calories every 3 hours for 4 meals. We do
Mm.
not eat 3 hours before we go to bed. You eat as within an hour to 2 hours of waking up in the morning. So you're actually giving your food a chance to digest. That's the 3 hours. And it gives your body a chance to use some of its reserves. And you're only giving yourself 1,600 calories a day. It also, you have the accountability groups and buddies and a coach to keep you on track. We had a little group me. So we were posting every day. The coach was posting stuff. For the first 2 weeks, we had to take pictures of our meals. What's the protein? What's the carb? What's the fat? How many calories was it? Weighing everything. So
Mm.
that's what's called intentional eating. I was obsessed with what food in a good way. What am I
Right.
going to eat in 3 hours? I meal prepped. Okay, how many calories is an apple? 57. How
Mm.
many calories is a clementine orange? 40. How many calories is one egg? 70. I
Yeah.
know all of this because I was intentionally eating, I was planning out my meals, and I was watching those numbers come down. So on the Ozempic, I got down to about 165.
Oh
On
wow.
this new way of eating, in 5 weeks, I'm down to 153 in 5 weeks. But that's intentional with
That's what I was gonna
support, with support. All but now he's asking us, we're getting ready to end. The program is over on Saturday. He's like, how are you going to stay on track? I'm going to continue to be mindfully eating.
say.
I'm going
Mhm.
to check in with my buddy that I got in this program. We're going to hold each other accountable. I have to also plan. I have a shift coming up tomorrow and a shift on Saturday. I know those are my most stressful times to eat. So I
Mhm.
need to take my whole bag of oranges.
Mhm.
I can have three clementines is 120 calories. I know that an apple, I know that an egg. So I've got to have my meals planned for the entire shift, check in with my buddy, drink my water. I've got to be intentional at the times where I know I'm most likely to come off of my eating plan. And then if I want to have a piece of pizza, that I told myself I can have junk once a month, twice at the most, and not go crazy with it. So watching the weight come off, seeing no Ozempic, the weight is coming off. I can't wait to see what my diabetes numbers are next week. I'm using the continuous glucose
Oh
monitor so I can see what my sugar is doing all the time. So I know how my body responds to certain foods and different fruits to see how high my sugars go. This
yeah.
is an intentionality at 60 as a diabetic of wanting to live a healthy life, and strong life.
Yes.
Over 50 into my 60s, my grandmothers both lived to 100. I want to see my great grandchildren graduate from high school. That's my dream. You guys can't even imagine that. You don't have grandkids. I'm 60, I've got grandchildren. I'd like to see my little baby grandchildren grow, finish high school, college, and then get married and have children. And I want to be healthy doing it. So that's my weight loss thing. Absolutely. Don't do Manjaro or Ozempic or Wegovy for 20 pounds.
Yeah.
Do it
Prevent it.
because your diet, your obesity is actually causing you health issues, and it has an opportunity to decrease long-term health outcomes. I really don't think that that these weight loss drugs should be used for people that need to lose 15 pounds. I think that, save that for the people who really, really need it. You can do lifestyle. And let me tell you, it's easy. You give yourself a shot in your stomach once a week and you lose 20 pounds. Sure. What are you going to do when that shot comes off? They say within 2 months, your cravings are back, your eating patterns are back, and your weight is back in 3 months. That everything that you lost is back within 3 months. So, you've got to be willing to do the medication and then start getting your head right. And then setting yourself up with structures, I call structures for fulfillment, structures that are going to support you when the shot is no longer in your system.
I love that for you, Dr. Booker. I love that, yes, it helped you get to the point where you wanted to be, but for you, it's very clear that you had the discipline and the intention behind it. And with that, you feel better and it's getting you to your ultimate goal, which is to live a full, healthy life. And that's ultimately what we've been talking about through our entire conversation.
That's it. The abundance of life at every level.
Yes.
And, absolutely, again, we'll go back to the body image stuff.
Mm-hmm.
We're not talking about cute.
Mm-hmm.
Big women are beautiful. That's not the
Yes.
issue. Those big women, they're not going to make it to 80. I'm just going to say it like that. They're going to be cute, but are they going to make it to 80?
Mm-hmm.
And who doesn't want to make it to 80? If I can be healthy and vibrant and vital, why not live as long as you can? What I don't want, and I think what we're set up in this society to be, is
Mm-hmm.
on a whole bunch of medication. So
Right.
we're living a long time pretty unhealthy
Right.
because we've got big pharma and health insurance and all, the powers that be, including food, the FDA,
Of
all
course.
together making money off of our unhealth.
Yes.
We can't, you can't, don't, you can't, you got to look and see. McDonald's will have up there that the extra value meal is 1,350 calories. They're
Mm-hmm.
telling you it's over 1,000 calories in one meal. They're giving the information to you so they know that you know. And still we choose it. Now, again, if you're doing it because it's once in a summer with the
Mm-hmm.
grandkid, okay. But to be
Right.
eating like that regularly and understanding you're taking in 3,000 calories a day of
Yeah.
junk, I call it food-ish. That's not
Mm.
real food. That's not real food. You see, I'm
I like
super
it.
passionate about all this.
I am no, I love it. And that is why I wanted to talk to you about this topic because, like I said, I was very intrigued with everything that you said at the conference. You all that didn't have the privilege to be there, this was one of the topics that she spoke about. And for good reason. It has had an impact on your life, your quality of life. And so you just ultimately want to see that for your patients and
That's
anyone
it.
that you come across
That's it.
to.
Anyone in my circle of influence. And, as far as this podcast goes, I want people to hear it. And don't be scared. I'll say this too. When I have the conversation with myself about food from a perspective of what I can't eat,
Mm-hmm.
I go into deprivation, that deprivation mentality. If I look at it as a gift I give myself, that these eating habits are going to give me longevity, or I love strawberries and blueberries. They do nothing to my blood sugar. I eat them and my blood sugar stays right hanging out there at 85 and 90.
Right.
Anything more than 150, 180 is high. My fasting before I eat is hanging out right at about 85 to 90. That's a good
Right.
number. I eat strawberries and blueberries, no change. If I eat, what did I notice? A mango or watermelon. There's certain pineapple. Those will put me up a little bit higher. It comes on back down. The way
Mm-hmm.
my body responds to blueberries and then I can do it with a sugar-free yogurt
Mm-hmm.
and throw some almonds on there. Now I've got my protein from my almonds, my fat from my almonds. I've got the
Mm-hmm.
protein from my yogurt, and I've got the carb from my berries. And I do it in a small, more of like a dessert cup rather than a cereal bowl.
Mm.
and I'm full. And don't forget, when you start decreasing the amount of food you put in your stomach, it shrinks that stomach. So you're
Yeah.
going to get full faster, so you eat less.
All these things tie in. All these things tie in. This has been such a good conversation. I have my last question for you. So, we're talking about feeling great and just overall quality of life. And the name of the podcast is Style and Conversation. So, I have to close it out by asking you a style related question. So, my question for you is, what piece in your closet makes you feel the most beautiful?
Oh my gosh. I have this dress,
Mm-hmm.
and I've had it for a while now. I've had this dress for 10 years.
Mm-hmm.
I love lace. It's an eyelet lace dress.
I love
It comes
eyes.
just above the knee. Eyelet is the lace that has the little holes in it. Got
Yes.
scalloped edges. It's got just a very small spaghetti strap, and then
Mm-hmm.
it's got these beautiful bell sleeves with this very intricate lace at the sides. So my shoulders are out. It's not form fitting. It's relatively straight, but it's above the knee. It's got that scallop, beautiful lace edging, and I just think it shows off my toned arms and shoulders. And then I wear very simple. I'm always wear very simple jewelry and accessories, and I love it with my hair up and a low heeled sandal, and I just feel like a princess. I feel like it that dress for me. I think it highlights the things that I love best about myself. I love my arms and shoulders. I love my legs and feet, and I love all the really cool things I can do with my hair. So yeah, I think that dress. Oh, what a great question! I love that dress. I will send you a picture of me in that dress so you can see
Sydney,
what I did with it.
I want to see a picture in it. And that's one of the things that I love about style. Just seeing the way you lit up when you talked about this dress, I can tell just how it makes you feel. And that's so important. That's so
Absolutely,
important.
absolutely, absolutely. Yeah,
That's so important.
yeah.
Ladies, only invest in pieces that make you feel great about yourself, but start by taking the advice that Dr. Booker shared with us and working on the things that take care of your insides. Dr. Booker, I am.
Can I
Oh,
say one more thing?
yes.
I hope you guys can you see this right here?
No.
It says play. I'm going to turn it a little
Yes.
bit. Can you see it?
Yes.
It says play. And I play, you should see this area. I'll show you what's on my desk.
Oh, you're about to make me go pull out my coloring book.
Wait a minute. This is my phone stand. It says explore. I've got candles all over the place. I've got coloring books right here. My coloring books are they save me. I love to color. It's inner child work for me. It really allows me to spend time with that little girl inside.
Mm,
I spend time in my garden. There has to be time that I am giving to myself. There has to be quiet time for spirituality. I don't get out of bed in the morning without doing my devotion. I've started in here. I've got my incense going. I've got smells that give me calm. I've got my wireless speaker. I'll come in here and put on what's called a sound bath. I get that from YouTube. And just let the frequency just be with the space. I've got my yoga mat there. I've got my warm blanket to cover up. I'm in here just marinating in the energy of love, peace, joy, overflow, and abundance around me. I do my crocheting. I've got a whole closet full of yarn here that is just about play and fun. It's colorful. It's my little girl can come in here and just have a field day. So we get tired of adulting. You know,
yes.
adulting really does take something from us every day, all day. Is there something you can do for yourself every day? If that's watch Frozen, or my favorite Tangled, or my favorite Princess Tiana, the frog, the frog,
Princess
the
Frog.
Princess and the Frog. You know,
Yeah.
is there a space where we can be 5 years old? Is there a space where we can let ourselves be 8? If we can remember what it felt like to, put on a pair of gym shoes and some bell bottom pants and skip down the street. Vision board, to actually put collaging and putting your dreams on paper. My vision boards are sitting up on the top of my bookshelf right now, so I can say, this is what I want for my life. This is what I see. And I've got empowering words all around that remind me when I forget the special little miracle of the universe that is Karla Booker. So
I'm glad you added that because I couldn't think of a more perfect way to end the episode, because you just shared more of your soul with everyone, and then that ties into your health. Taking care of the things that bring you joy, nurturing those things. I love it. And I want to encourage everyone, as you listen to this episode, to tap back into those things. Do one thing. After the evening you listen to this, go do one thing that brings you joy. If it's getting in your garden, if it's taking a walk with your dog, if it's crocheting, if it's cooking a meal, a nice dessert, whatever it is, go do that.
That's right.
Recharge your soul. I love it.
Recharge and replenish. I love it.
Yes. Dr. Booker, thank you so much. This has been another episode of Style and Conversation. And be sure to keep up with us on all platforms where you stream your podcast, as well as on YouTube. And stay tuned for our next episode. Talk to you soon.
Awesome.
Hey, Style Crew. Make sure you're keeping up with our podcast through Spotify, Apple Podcasts, Amazon Music, as well as the Podcast Index. And if you'd like to view the podcast visually, check out my YouTube channel, Styled by Jessica Lauren. And don't forget to follow us on Instagram at style_and_conversation podcast. Hey, Style Crew. Make sure you're keeping up with our podcast through Spotify, Apple Podcasts, Amazon Music, as well as the Podcast Index. And if you'd like to view the podcast visually, check out my YouTube channel, Styled by Jessica Lauren. And don't forget to follow us on Instagram at style_and_conversation podcast.